What's up, fam? Just want to let y'all know I'm in a little teeny bit of pain. Not a whole lot of pain, just a little bit of pain. I just had the wisdom tooth pulled. So yeah, I'm out here in a little bit of pain. I'm riding around now trying to get the prescription filled. You know how that is, you know. It's gonna take time to get that prescription filled because of COVID-19 testing and stuff. So the girl told me it was gonna take me 3 hours to get that prescription full. So I'm out here riding around now. I'm gonna go to another CVS after I go get me some gas and get this truck washed. But I need to go to another CVS to try to get this thing filled up. But I went in there, King Oral Surgery, and I don't know the doctor's name. Let me see if he got his name. I'll give you the doctor's name because he was pretty good. I mean, I went in there and I tell you, I was ready to act a fool because I thought that I was going to be in pain. I said, man, I'm going to go in here and he going to have me crying and bleeding and falling out the chair, acting a fool. I thought I was going to be hurting up in that joint, but I'm going to tell you, this is what they had. They gave me an option. And you know, the option was either awake or we're going to put you to sleep. So if you know me and you know me good, and you know I'm cheap, and you know I ain't got it, so you know, here's my two options. We can put you to sleep, but your insurance is only going to cover but so much, and they're not going to cover you to be put to sleep. I said, okay, you know what I'm saying? It can't be that much. I'm going to go to sleep. I ain't want to be awake through the procedure because I'm thinking like, hey, I know if you jump in the sperm and I'm be hurting, be in a whole bunch of pain. So I was like, man, y'all gonna have to put me to sleep. So she said you can either be asleep or you can be awake. I was like, all right. So I'm laying in the back. I'm sitting in the chair and I'm waiting for them to come and tell me. So they didn't tell me the information until I was checking out 2 days ago. So the girl said, since your insurance won't cover you to be put to sleep, it's going to be $500 for you to be put to sleep. I said, okay. So I'm thinking, well, you know, it's about what I kind of thought it would cost. So I was ready to pay, you know what I'm saying? You know, put it on the credit card, woo-woo, get up out of there, you know, and deal with, you know, whatever I got to deal with after the fact. So that's what I was going to do, right? So I said, well, how much would it be if I stay awake? She said $20. I said, well, what, you gonna numb it? She said, yeah, we're gonna numb you real good. I said, okay, well, I'm gonna go ahead and stay awake because I want to see what you're doing anyway. So she was like, all right, so you gonna be awake? I was like, yeah, I'm gonna be awake. She said $20. $20. Okay. Yeah, $20. Yeah, I'm gonna be awake. I don't even go to sleep that bad, so I stayed woke. I looked at the doctor laying in the bed just like this. I said, yeah, I'm woke. He said, all right, we're going to numb you a little bit. I said, well, do what you do. So he got the numbing and stuff starts, you know, he put the first thing he did was he put this numbing cream. He put the numbing cream in my mouth, right? You know, all of my gums and stuff, rubbed my gums with the swab. He said, you know, open up, numbed it up. I said, oh, you know, this stuff ain't gonna work. You know, I still feel stick. You know, when he's sticking me with it, I can feel a little stick. So then he was like, close your mouth. So I closed my mouth, and he left the joint in my mouth. So I said, all right. Then he said, open your mouth back. He come back with the needle. He said, all right, I'm gonna numb you up some more. I said, oh, so now you gonna stick me in my mouth? So he just kept on sticking me in my mouth. Telling me, you feel it? I said, yeah, I feel that. He said, you feel it now? I said, okay, no, I don't feel that. So the pain went away. I didn't feel it no more. Then he said, we're going to wait for a minute. Close your mouth and relax. I closed my mouth and relaxed. I said, I can still feel my lips. So, you know, because I felt my lips, I thought that I was going to feel what he was doing back there. So I'm kind of nervous. I'm sitting in the chair. He's talking, let me tell you, this is a funny part. He said, you got to use the bathroom? I said, it's going to be that intense? He said, no, I just like to make sure you got your bladder empty. I said, oh. Maybe I should force myself. I said, because I ain't trying to be in here and pee on all of myself while I'm sitting in the dentist office getting a tooth pulled. So he was like, you should be all right if you don't have to go. He said, you don't have to force yourself. I said, all right, we can go ahead and get this done. And we can do this then. But yeah, after he, you know, poked me all in my mouth and stuff, you know, with the needle, my lip felt like this. My mouth still feels swollen. I don't know if it looks swollen to y'all, because I can't tell. So he poked me all in my mouth, got my stuff falling all numb and stuff. So then he came back with these pliers and stuff. He was talking about some, yeah, you gonna feel me pushing and pulling. I said, pushing and pulling. He said, yeah, you gonna feel me pushing and pulling. So what he did was, he took the pliers and stuff, started pushing my teeth and pulling my teeth. He was pushing and pulling. Like he said, he was pushing and pulling. He was like, all right, well, it's not coming. So then he went and got this little drill thing and started. I don't know if it hurt. I think the noise got me more than anything, because I heard it. Bzzz. I said, oh, yeah, that's going to hurt. Because, you know, the noise can give you an idea of what you're going to feel. So when I heard that joint, bzzz, he said, you feel that? I said, yeah. I don't know if I felt it or not, but I know I heard it. So I was like, yeah, I feel it. So then he was like, all right, give me a minute. So then he started sticking me again with the stuff, numb me up some more. So then he came back over there. He said, you gonna feel me pushing and pulling again. I said, all right. So he got the pushing and pulling again. And then I was like, man, this tooth ain't gonna never come out. So that's what I'm thinking, right? So I'm laying in the joint, I'm thinking like, man, I still feel that tooth in there. He said, yeah, it's gonna be breaking up a little bit, and then it's gonna fall out, and then it's gonna be, yeah. And so I was like, yeah. So he got the pushing and pulling. So he did that. Then he turned his back on me. And when he turned his back on me, I'm like, well, what are you doing? He had something in his hand. I don't know what he had in his hand. I never saw it because I was laid back. So I never saw what he had in his hand. So whatever he had in his hand, I don't know what it was. Or whatever it was, he might have had my tooth in his hand. I don't know if he had my tooth in his hand, or if he had a tool in his hand or whatever. But anyway, I looked at the nurse and I was like, that tooth ain't gonna never come out. She's like, it's out. I said, it's out. She said, yeah, it's out. I said, how is it out? She said, it's out. I said, I still feel it. She said, no, that's not the tooth. I said, oh, okay, I thought it was the tooth. She said, no, it's not the tooth. You still spitting because I can't feel my mouth now. Yeah. But anyway, King Oral Surgery, Dr. Michael King, 4255 Altamont Place, White Plains, Maryland, Suite 302. They did some good work, man. Then I gotta change his gauze. I ain't gonna do that on here because that's nasty. Keep y'all updated. Oh, and he stitched it up. I ain't even feel him putting the stitches in. Yeah. But I do feel like I'm about to start feeling pain, so I gotta get my medicine out.